Good afternoon, everybody. It's Laura Harnett here from Rural Health West. Today's webinar is on the Practice Incentives Program, but I will refer to it as the PIP throughout the webinar. Everybody is muted at the moment, so we can reduce any background noise, so feel free to sing amongst yourselves. If you haven't already chosen your audio choice, you can use telephone or the computer speakers, and the instructions will be showing on the GoToWebinar screen on your computer. And if you have any questions throughout the webinar, please use the chat box and we'll take note of them and either answer them throughout the webinar or get to them at the end. If there's anything that we can't answer throughout the webinar, we'll follow up with communication with you directly. Just a short overview of today's webinar. We'll go over generally what the Practice Incentives Program is, the eligibility criteria to join the program, the different types of payments, and we'll also touch on the individual incentives, their criteria and the payments, and then we'll get to questions at the end. So, what is the Practice Incentives Program? Commonly referred to as the PIP, the Practice Incentives Program aims to encourage continuing improvements in Australian general practice through financial incentives to practices who support quality care and improving health outcomes for patients. The PIP is administered through the Australian Government Department of Human Services, Medicare. A general practice and any associated branch or satellite practice can join the PIP by completing the application package and attaching all required supporting evidence, which includes practice bank account details, evidence of public liability insurance and professional indemnity cover for all GPs and nurse practitioners, evidence of general practice accreditation, individual PIP declarations, details of current GPs and nurse practitioners, practice ownership details, and signatures of partners and associates of the practice. But what is general practice? For the purposes of the Practice Incentives Program, the Medicare used the RACGP guidelines, which define a general practice as displaying the key features of providing initial, continuing, comprehensive and coordinated medical care for individuals, families and communities, and which integrates biomedical, psychological, social and environmental understandings of health. To be eligible to participate in the PIP, a practice must be accredited or registered for accreditation against the current RACGP standards for general practices, which are now in their 4th edition. Practices are required to achieve full accreditation within 12 months of joining the PIP and maintain full accreditation after that. However, claims for PIPs can commence as soon as your practice has registered for accreditation. Just a short poll here now. If you can indicate by using the writing tool, the highlighter in your panel, if you are currently registered for the Practice Incentives Program, if you're not currently registered for the PIPs, if you're not a general practice, or if you are in the process of applying. And if anyone is in the process of applying for a new PIP or for the PIP from the beginning, please don't hesitate to contact Rural Health West for support in identifying how to do this. Also, to be eligible for the Practice Incentive Program, a practice must meet the definition of an open practice, therefore be providing face-to-face medical or health services to patients at a physical location. The practice must maintain public liability insurance and must make sure all general practitioners and nurse practitioners maintain current professional indemnity cover. In Australia, we classify general practitioners who hold fellowship with the Royal Australian College of General Practitioners, or the Australian College of Rural and Remote Medicine as specialists. This is also known as holding vocational registration, or VR. Medical practitioners undertaking approved training, such as GP registrars and non-VR international medical graduates, are also classified as GPs for the purposes of PIP. For the purposes of PIP, a general practitioner includes non-specialist medical practitioners known as other medical practitioners who provide non-referred services but are not general practitioners, such as registrars and overseas trained doctors working on their exams. Administered by Medicare Australia on behalf of the Australian Government Department of Health, PIP is part of a blended payment approach for general practice. Payments made through the program are in addition to other income earned by GPs and the practice, such as patient payments and Medicare rebates. Currently, PIP is made up of 11 incentives and practices can apply for as many of these as they are eligible for. Current PIP payments include asthma, cervical screening, diabetes, eHealth, GP aged care access, Indigenous health, procedural GP, quality prescribing incentives, rural loading and the teaching incentive. The practice nurse incentive can also be included but will not be covered today. Another poll here if you'd like to indicate which incentives you are currently claiming. Okay. Each PIP incentive has its own program eligibility criteria, questions and required supporting evidence. For example, in order to register for the eHealth incentive, a practice is required to meet each of the 5 requirements for the entire quarter prior to the payment month. These are to integrate healthcare identifiers into our electronic practice records, have secure messaging capability, use clinical coding for the majority of diagnoses, electronically transfer the majority of prescriptions, and apply to participate in the personally controlled electronic health record. PIP payments are based on a measure of the practice size known as the Standardised Whole Patient Equivalent, or SWPE value. The SWPE value is calculated using MBS claims by patients attending the practice during an historical 12-month period known as the reference period. The reference period is a rolling 12-month period that commences 16 months prior to the payment quarter. For example, payments received in the August quarter are calculated using practice size data for the 12-month period ending 31st of March of that year. PIP payments do not attract a goods and services tax, and a table of how these payments and quarters are calculated is shown later. To calculate the SWPE value, the SWPE value of a practice is the sum of the fractions of care provided to the practice patients, then weighted for the age and gender of each patient. Medicare benefits schedule services provided by both GPs and nurse practitioners are included in the SWPE value of a practice. As a guide, the average full-time GP has a SWPE value of around 1,000 SWPEs annually. In addition to the SWPE, the Whole Patient Equivalent, or WPE, is also used to calculate some PIP payments. The WPE is based on the GP and other non-referred consultation items in the Medicare benefits schedule and uses the value rather than the number of consultations per patient. The total care for each patient equals 1. The SWPE value of a practice is calculated in 3 steps. The WPE equivalent of each patient, which is calculated using the fraction of care provided by a practice to a patient. As said previously, the total care for a patient equals 1. The WPE is based on practitioner and other non-referred consultation items in the Medicare benefits schedule and uses the monetary value rather than the number of consultations per patient. For example, in a 12-month period, if a patient has $100 in Medicare benefits at practice A and $400 in Medicare benefits at practice B, that is a total of $500 in Medicare benefits. Practice A would be signed $100 or 0.2 of the patient's care, and practice B would be assigned $400 or 0.8 of the patient's care. Therefore, the total care for the practice equals 1. Weighting is then applied to the WPE to become the SWPE. The WPE weighting includes weighting for age and gender of each patient. The total SWPE and WPE values are then added together to determine the SWPE value of the practice. To qualify for payments, practices must be participating in the PIP and meet the eligibility requirements of the incentives for the entire quarter, including the point-in-time date. The point-in-time date corresponds to the last day of the month before the next PIP quarterly payment. This table will also be available for you to keep. For the purposes of the PIP, additional practice locations are known as practice branches. Practices must nominate the main practice location when completing the PIP application form. The main practice location should be the one that provides the highest number of Medicare benefits services each year. Practice branches that provide less than 3,000 services per year do not need to be accredited in their own right. So practices that provide more than 3,000 services per year must maintain full accreditation to be eligible for PIP. What are the types of payments? The majority of payments through the PIP are made to practices and focus on those aspects of general practice that contribute to quality care. PIP practice payments are intended to support the practice to purchase new equipment, upgrade facilities, or increase remuneration for GPs working at the practice. For example, the cervical screening incentive pays a one-off 25 cents per SWPE to practices that engage with the state and territory cervical screening registers. Service incentive payments, or SIPs, are generally made to GPs to recognise and encourage the provision of specified services to individual patients. For example, the cervical screening incentives pay $3 per eligible WPE as an outcomes payment to practices where at least 70% of eligible patients are screened in a 30-month reference period, and $35 per patient for each cervical smear taken on an underscreened woman aged between 20 and 69 years. Practices participating in the PIP with a main practice location situated outside a major metropolitan area are automatically paid a rural loading. The rural loading recognises the difficulties for providing care, often with little professional support in rural and remote areas. The PIP rural loading is higher for practices in more remote areas in recognition of the added difficulties of providing medical care. The PIP rural loading is applied to PIP practice payments, service incentive payments, and payments made through the general practice immunisation incentive do not attract the rural loading. So moving on to the individual asthma incentive now. The asthma incentive encourages general practitioners to better manage the clinical care of people with moderate to severe asthma. For patients who are assessed as having moderate to severe asthma, such as symptoms on most days or use of preventative medication or bronchodilator use at least 3 times per week, or hospital attendance or admission following an acute exacerbation of asthma. The asthma incentive requirements include participation on the program, maintain a patient register, the use of recalls and reminders, and implementing cycles of care. SWPE payments are made for a cycle of care completed in a 12-month period. This includes the 3 steps of assessment, planning and review. The assessment and planning steps may be conducted in one consultation. The asthma incentive payment steps. The first step is a sign-on payment, which is a one-off payment of 25 cents per SWPE. The service incentive payment of $100 per year for each cycle of care completed. And once a cycle of care is complete, you can use the Medicare benefit schedule to claim one of the following MBS items, which will trigger the cycle of care. So MBS items 2546, which is the equivalent of a level B, MBS item 2552, which is the equivalent of a level C, and MBS item 2558, which is the equivalent of a level D. As a minimum, the asthma cycle of care should include at least 2 asthma-related consultations within 12 months. At least one of these consultations should have been planned at a previous consultation. Documented diagnosis and assessment of the patient's level of asthma control and severity of asthma. A review of the patient's use of and access to asthma-related medication and devices. Provision to the patient of a written asthma action plan, provision of an asthma self-management education to the patient, and a review of the written or documented asthma action plan. The cervical screening incentive aims to encourage the screening of underscreened women for cervical cancer and to increase overall screening rates. An underscreened woman is someone who has not had a cervical smear in the last 4 years. PIP cervical screening payments are made as a sign-on payment, which is 25 cents per SWPE, to practices that engage with state and territory cervical screening registers. An outcomes payment, which is $3 per WPE, to practices where at least 70% of eligible patients are screened in a 30-month reference period. And a service incentive payment, which is $35 per patient for each cervical smear performed on an underscreened woman aged between 20 and 69 years. Once the practice is registered for the cervical screening incentive, they are required to agree to have their practice details provided to state and territory cervical screening registers, receive information from state and territory cervical screening registers, and consider how they can improve the level and quality of participation in the National Cervical Screening Program, and agree to state and territory cervical screening registers providing information about the aggregate number of women screened in the practice. An application to participate in the cervical screening incentive includes a request for account details. The practice incentive program will pay successful applicants the sign-on payment in the next quarter. MBS cytology services are used to determine the number of women screened in the reference period. Once a practice meets the target, the outcomes payment is automatically paid in the next quarter. General practitioners need to use one of the following MBS cervical screening item numbers on eligible under-screen payments to trigger the service incentive. The item numbers are 2497, which is the equivalent of a level A, 2501, which is the equivalent of a level B, 2504, which is the equivalent of a level C, and 2507, which is the equivalent of a level D. Now on to the diabetes incentive. Once a practice is registered for the diabetes incentive, they are required to participate in the program, maintain a patient register, use recalls and reminders for patients with diabetes, implement cycles of care. SIP payments are made for a cycle of care completed in a 12-month period. This includes the 3 steps of assessment, planning and review. As for the asthma incentive, the assessment and planning steps may be conducted in one consultation. The diabetes incentive payments include a sign-on payment, which is a one-off payment of $1 per SWPE, an outcomes payment, which is $20 per diabetic SWPE per year to practices where at least 2% of practice patients are diagnosed with diabetes and at least 50% of these patients have completed a diabetes cycle of care. A service incentive payment of $40 per year for each cycle of care is also paid. To claim the diabetes cycle of care, use the Medicare benefit schedule items to claim one of the following. This will trigger the SIP. MBS item 2517, which is the equivalent of a level B, MBS item 2521, which is the equivalent of a level C, MBS item 2525, which is the equivalent of a level D. At a minimum, the diabetes cycle of care should include patient education and review of the patient's diabetes management, appropriate dietary choices, physical activity, smoking and medications. The diabetes cycle of care will also include assessment of diabetes control by measuring the HbA1c once a year, a comprehensive eye examination once every 2 years, a measure of weight, height and the body mass index twice every cycle of care, blood pressure twice every cycle of care, a foot examination twice every cycle of care, total cholesterol, triglycerides and HDL cholesterol once a year, a test for I'm not even going to attempt to say that word, at least once every year, and a test for glomerular filtration rate at least once every year. The eHealth incentive aims to encourage general practices to keep up to date with the latest developments in eHealth, adopt new eHealth technology as it becomes available, and to help practices improve administration processes and patient care. eHealth payments are available to eligible practices who can receive up to $12,500 per quarter based on $6.50 per SWPE per year. Practices need to maintain the eligibility for the entire preceding PIP payment quarter, including the point-in-time date, to be eligible for the quarterly payment. The point-in-time date is the last day of the month before the next payment quarter. For example, to be eligible for the November payment, practices must keep their eligibility from 1 August up to and including the point-in-time date of the 1st of October. So we briefly mentioned earlier what the PIP incentives require. Practices are required to integrate healthcare identifiers into electronic health records, have secure messaging capability, utilise clinical coding for the majority of diagnoses, electronically transfer the majority of prescriptions, and apply to participate in the personally controlled electronic health record. The GP Aged Care Access Incentive aims to encourage GPs to provide increased and continuing services in residential aged care facilities. To be eligible for the PIP GP incentive, aged care incentive, GPs must be working from a registered PIP practice, be providing eligible Medicare benefits schedule services to residents in aged care facilities, reach the qualifying service level by providing the required number of Medicare services in the residential aged care facility in a financial year, and use a Medicare provider number that is linked to a PIP practice when claiming the Medicare items in the aged care facility. The PIP GP Aged Care Access Incentive payments are based on a general practitioner providing a required number of eligible Medicare services in an aged care facility in a financial year. For services to be counted towards the qualifying service level, GPs must claim the Medicare services provided in the aged care facility using a Medicare provider number that is linked to a PIP practice. The PIP GP Aged Care Access Incentive has two payment tiers. The first tier requires 60 services in a financial year to be eligible for $1,500 per financial year. The second tier requires 140 services in a financial year, which entitles $3,500 per financial year. The Medicare benefit schedule services that count towards the qualifying service level include attendance items at an aged care facility. Those GP visit item numbers include items 20, 35, 43 and 51. Non-VR visits to the aged care facility of items 92, 93, 95 and 96, and also after-hours visits by VR and non-VR GPs, which are listed on your screen. Also, contributions to care plans, MBS item 731, and residential medication management reviews, MBS item 903. The Indigenous Health Incentive aims to support general practices and Indigenous health services, referred to here as practices, to provide better health care for Aboriginal and Torres Strait Islander patients, including best practice management of chronic disease. This incentive is a key part of the Council of Australian Government's COAG National Partnership Agreement on Closing the Gap. Indigenous Health Incentive payments has three components. The practice sign-on payment, which is a one-off payment of $1,000 per practice. The patient registration payment, which is $250 per eligible patient per calendar year for a patient who is registered with the practice for their chronic disease management. And an outcomes payment, which is split into two tiers of $100 per eligible patient per calendar year, where a target level of care is provided, and the second tier, which is $150 per eligible patient per calendar year for providing the majority of a registered patient's care. To sign on for the PIP Indigenous Health Incentive, practices are required to gain consent to register their eligible ATSI patients for the PIP IHI and or the PBS co-payment measure with the Department of Human Services. You are required to use a system to make sure that Aboriginal and Torres Strait Islander patients aged 15 years and over with a chronic disease are followed up. Practices are also required to undertake cultural awareness training within 12 months of joining the incentive, unless exempt, and annotate PBS prescriptions for ATSI patients participating in the co-payment measure from July 2010 with CTG. A patient registration payment of $250 is made to practices for an Aboriginal or Torres Strait Islander patient who is a usual patient of the practice, is aged 15 years and over, who has a chronic disease or diseases, has had or has been offered a MBS item 715 health check, who has a current Medicare card and has provided informed consent to be registered for the PIP-IHI, and the practice has submitted those consent forms to the Department of Human Services. There are 2 tiers of outcomes payments available each calendar year for each registered patient. Outcomes payments are based on Medicare Benefits Schedule services provided from 1 January to 31st of December of each year the patient is registered. Outcomes payments are only made to the PIP practices that are signed on for the IHI. Practices may be eligible for either or both outcomes payment even if the patient is currently registered for the PIP-IHI at another PIP practice. Procedural GP payment aims to encourage general practitioners in rural and remote areas to maintain local access to surgical, anaesthetic and obstetric services. For the purposes of this payment, a procedural GP is one who provides non-referred procedural services in a hospital, theatre, maternity care setting or other appropriately equipped facility, which in urban areas would normally be a specific referral-based specialty. Eligible procedural services are obstetric delivery, general anaesthetic, and abdominal surgery, gynecological surgery requiring anaesthetic or endoscopy. Minor procedures such as aspiration of a knee joint do not fit the intent of this incentive. To be eligible for the procedural GP payment, the practice must have at least one GP from the practice providing one or more of the procedural services as described in the definition of a procedural GP. They must meet the activity requirements for claiming PIP payments in the relevant tier as outlined in Table 1, which is to come, and be located in a rural and remote RAMA 3 to 7. There are 4 tiers of procedural payments. The tiers are not cumulative and each individual GP can only qualify for one tier per payment period. The PIP procedural GP payment is automatically paid to the practice every 6 months in February and August, directly into the practice's nominated bank account. There is no limit to the number of procedural GPs who can generate payments for a practice. However, GPs must individually meet the requirements of the tier before the practice can make their claim. Tier 1 requires at least one procedural service as defined in the 6-month reference period, which entitles up to $1,000 per procedural GP per 6-month reference period. Tier 2 includes the meeting of Tier 1 requirements and providing after-hours procedural services on a regular or rostered basis, which is 15 hours per week on average, either on call or on a roster, throughout the 6-month reference period, which equals up to $2,000 per procedural GP per 6-month reference period. Tier 3 requires the meeting of Tier 2 requirements and the provision of 25 or more eligible surgical and or anaesthetic and or obstetric services in the 6-month reference period, which entitles up to $5,000 per procedural GP per 6-month reference period. Tier 4 requires the completion of Tier 2 requirements and the delivery of 10 or more babies in the 6-month period, which entitles $8,500 per procedural GP per 6-month reference period. Just a reminder that for the purposes of the PIP, after hours refers to any time outside 8 a.m. to 6 p.m. on weekdays and 8 a.m. to 12 noon on Saturdays and any time on a Sunday or a public holiday. The Quality Prescribing Incentive aims to encourage practices to keep up to date with information on the quality use of medicines. The PIP QPI rewards participation by practices in a range of activities recognised or provided by the National Prescribing Service. To be eligible for the PIP QPI, a practice must meet the minimum participation level by the 30th of April each year by participating in 3 activities in the reference period, which is the 1st of May to the 30th of April, for each full-time general practitioner each year, one of which must be a clinical audit, and you must make sure the National Prescribing Service is correctly advised of activities completed by the general practitioners by the 30th of April each year. Recognised activities include a clinical audit of prescribing for specific drug groups using materials approved or produced by the National Prescribing Service, case studies using problem-based distance learning provided by the NPS. The case studies present a clinical scenario with a set of questions designed to help participants refine their clinical decision-making skills. Or a practice visit by an independent pharmaceutical dealer as detailed by the NPS. These academic detailing visits are a resource for general practitioners and promote the quality use of medicines. For example, a practice with 1 full-time equivalent GP must participate in 3 activities, including at least 1 clinical audit to receive a payment. A practice with 5 full-time equivalent GPs must participate in at least 15 activities, including 5 clinical audits to receive a payment. Some GPs in the practice may participate in more or less activities so long as the practice as a whole averages 3 activities per full-time equivalent GP. The Quality Prescribing Incentive payments are calculated at $1 per SWPE per year. The payment for the PIP QPI is made to the practice annually in the May quarter. For more information, I would encourage you to visit the NPS website. The teaching incentive aims to encourage general practices to provide teaching sessions to undergraduate and graduate medical students who are preparing for entry into the Australian medical profession. Payments are intended to compensate practices for the reduced number of consultations due to the presence of the student. An eligible teaching session must be provided to a student enrolled in an undergraduate or graduate medical course accredited by the Australian Medical Council. The course must be at an Australian university that is preparing them for entry into the Australian medical profession, and the teaching session must be part of the student's core curriculum. The student must be studying at an Australian-based campus. In WA, this is Notre Dame University and the University of Western Australia. An eligible teaching session must be provided by a general practitioner who is responsible for the teaching session, including those sessions provided outside the practice, such as home visits and consultations in hospitals or aged care facilities. It also must be provided by a general practitioner from the practice participating in the PIP when the teaching sessions took place, and a minimum of 3 hours in length. Teaching sessions are not payable for registrars and junior doctors, nursing, allied health or pharmacy students. They are also not payable if the supervising general practitioner is paid for teaching activities through another Australian government-funded teaching program, such as the John Flynn Placement Program. However, the Rural Clinical School is not affected. For each 3-hour teaching session carried out after the 1st of January 2015, practices will receive $200 per session. Practices can claim a maximum of 2 sessions per general practitioner per calendar day. Payments are made quarterly after teaching sessions have been provided. We've already gone over the rural loading, so it's popped back up, so I'll just skip through there. So when should you contact the Practice Incentives Program staff? Well, if any practice arrangements change that may affect your eligibility, for example, if a general practitioner or a nurse practitioner leaves or joins the practice, if there are changes to the authorised contact person, if there are changes to the practice bank account for PIP payments, if there are changes in your accreditation status, if your eligibility or level of activity for incentives changes, if the location or ownership or structure is changed, or if there are lapses in the practice public liability insurance or an individual practitioner's professional indemnity cover. Likewise, if there are any changes in provider numbers for any practitioners. Don't forget you can use the Health Professional online service for updating any of these items. Things to think about. Do you know your practice SWPE value? Have you read the guidelines of the practice incentives that you are claiming? And are PIPs and SIPs mentioned in the contracts with your doctors and your nurse practitioners? Rural Health West is here to help you as well as always with your practice and business support. If you have any questions about the Practice Incentives Program, we can conduct an audit on your current PIP claims. We can identify potential PIP entitlements that you are not claiming or not claiming to your full benefit and provide you with a full report on these. We can also then work with you to write a quality improvement project on individual PIPs to meet those standards. If you have any questions about the Practice Incentives Program, here is the link to the website. The guidelines have recently moved, so if you can't find them, this is where they are now located. And of course, you can always contact Sonia or myself at Rural Health West for some support. We do have a couple of questions here. I'm just going to attempt to bring them up. They don't seem to be showing, unfortunately, so I'll have to work with the software and get back to you, unfortunately. You can use the chat box to type in any messages or send us an email to workforcesupport@ruralhealthwest.com.au. Thank you very much for your time today, and as I said, I'll address those questions and email the answers around. Thank you.